I was here in 2006 and testified, and I'm compelled to present myself once again concerning the use of dental silver and mercury amalgam due to the enormity of this public health issue. Many of the first symptoms of mercury poisoning are neurological and psychological in nature, causing irreversible and permanent damage. It is crucial to note neurotoxicity is not an allergy. Who is first to be exposed and on the front lines every day being negatively affected by chronic mercury vapor exposure, even before any trusting patients? The 266,000 dental assistants that are serving millions and who are lacking the serious full body protections needed during the placement and removal of this toxic material. That number is one less since I've been done.
Sorry. We wouldn't hear it plainly though.
That number is one less since I've been diagnosed as carrying 1,275% total mercury body burden above normal baseline and having received a definitive diagnosis of heavy metal toxicity to mercury and lead in 2004 could no longer work. In September 1998, I experienced a very sudden onset of a combination of stroke and heart attack symptoms, including full body tremors that I know now to be caused from chronic mercury vapor exposure. My symptoms abated. Then, in July of 2003, I was struck with pain, numbness, tingling, facial, and later body burning sensation. I had to see a neurologist. The neurologist provisionally diagnosed me with MS due to my sensory disturbances, but eventually decided in January 2004 that my brain was just misfiring and more active on that side. Interesting to note that the neurologists that were here in 2006 apologized to the consumers and said, "We are sorry, we don't look for this. We don't look for environmental toxin factor in toxic neuropathy." And so that's where folks are falling through the cracks with this. What I've experienced firsthand includes metabolic and hormonal dysfunction, sensory loss, emotional liability, melanoma, breast pathology, toxic nodules, progressive white matter lesions in my brain, GI disturbances, insomnia, memory loss. There's over 100 symptoms for mercury toxicity. I witnessed many of my colleagues experience thyroid disease, infertility, spontaneous abortions, miscarriages, and stillbirth. Most worked through their pregnancy and while nursing. Clearly, women in dentistry are not only at the greatest risk for mercury exposure, but they are not adequately protected by present standards. Mercury vapor masks should be worn in order to truly be protected, but the manufacturers, the ADA and OSHA, state otherwise, or not at all, sadly. Paper masks aren't cutting it. Vapor goes right through paper masks and your latex gloves that you think are protecting you. That my injuries were 100% preventable causes me great anguish and outrage, but the patients that I harmed is most troubling. I continue to suffer every day from the neurological damage to my body. I'm not a pregnant woman, child, fetus. I have neurological damage head to toe. The result of handling mercury daily at my job for 25 years as a dental assistant, now disabled to a combination of impairments that limit me to function normally. Severe paresthesia, memory loss, chronic fatigue, peripheral neuropathy, loss of tendon reflexes, along with other symptoms of demyelination that is hallmark of progressive neurodegenerative diseases like MS, ALS, Parkinson's, and Alzheimer's continue to plague me. Learning that dentists who continue to place this cumulative neurotoxin are affecting the health of the entire body as mercury leaches out of the fillings and is absorbed throughout from head to toe is most sobering. And the harsh reality that mercury lodges in the brain, where it stays year after year.
Excuse me, we need to ask you to sum up.
Suppressing the immune system and killing neurons by destroying their myelin sheath. I am living proof of that. How great is it now that countries have...
Can you sum up, ma'am?
Yes.
Okay.
I just state that in other countries like Norway, where mercury has been banned. It is interesting to note that dental assistants are covered by a trade union.
Thank you for your presentation. We really need to stick to the time. I'm sorry.